Hello, everyone, and welcome to our next episode of NXL's The Pearl Cruise talk show on our podcast. And I have somebody very dear to me, my very good friend. We spent 4 years together as we graduated in health sciences. I have Shilpa Tharian, who is, of course, now practicing in New York. She is the adult gerontology nurse practitioner, an independent practitioner, and a primary care provider at New York City Health and Hospital, South Brooklyn Health. Thank you so much, Shilpa, for joining me on this show.
Hi, Pearl. Thank you for having me. And I'm so pleased to see how successful and influential you have been since we graduated to this time, right? And it really makes me proud when my own course mates, batchmates, they do something wonderful. They give an extra step up about what they are supposed to be doing and the innovation they create in each area they're practicing. Thank you for having me.
Thank you so much, Shilpa. Absolutely. It's my pleasure, I would rather say, because likewise, what you said, it gives me a very proud feeling to see my batchmate, practicing independently in a field which probably is just upcoming in India. And that's the reason why I wanted to invite you as a guest on my show to showcase the new generation of nurses and the ones who are aspiring to be care practitioners in India, which is a new course which is coming up. And I think there's a first batch which is going to get graduated. People are going to practice this particular new field in India. And hence, I thought it will be nice for you to be on the show and give them a view of what it is like, to be an independent care provider. So let's go on to our questions now. So the first thing that I would like to, of course, ask you, what really inspired you to pursue a career in the field that you are? And what challenges did you face on the way while you're doing this?
So growing up, I always wanted to be a doctor. I don't know if everybody knows, when you're born in an Indian family, you're a doctor or you're an engineer. But apart from that, seeing the conditions I grew in, I was from a middle class family and liking to care for people, being sick myself, being bedridden, having an accident and not being able to work for 6 months after I was 3 or 4 years and couldn't walk on my leg. I wanted to do something which would make a difference in everybody's life. When I graduated 12th grade, the tuitions and my family's financial status wouldn't let me go off to a far off state to do my medicine school because of the financial challenges my parents had, right? The dorming, the education fees. And my aunt, who I always say is the most influential person in me selecting nursing as a career. She's a retired, she's no more, but she's a colonel from the military nursing services. I was immensely impressed by her. How she carried herself, how she took care of everybody sick in the family. She had a solution for all problems, big or small, and her attitude towards each thing, and able to manage different sections in the family, bringing them together, helping out when needed, and overall her personality. I can't stop talking about her, but she and my uncle, everybody came and said, give it a try. It will help you sustain your living. It will also help you bring up the family because, as everybody knows, when you think of going to nursing, it means you're going abroad, working, making the money, helping the family. So I started off my bachelor's of science. We all started off at LTCN SNDT, and we did our 4 years of program, which was beautiful. The first year was the most beautiful and the most difficult, and staying
Yes.
away from family and selecting something which you didn't want to do. That was a big, big change. But then I saw that I liked what I did. Being a nurse wasn't that bad. And my college itself, I think it taught all of us, all our batchmates in the same group, it taught us how to be independent, how to survive in
Right.
life, whether it's happy moments, sad moments, how to take care of it one day at a time, be a wonderful multitasker, try to handle a lot of challenges together and do justice to your academics at the same time. Provide care with the rural areas, with the urban areas, do your rotations in the different clinical hospitals because we didn't have an own hospital where we did our rotations, and meet people
Right.
from different backgrounds, people with different health disparities, people with different culture, and how to provide the same care, just culturally competent, being emotionally intelligent, using all those. I think our school taught us a lot. And when we
Right.
finished our 4 years and we graduated, I was of the feeling that actually nursing isn't bad. I think our school did a great job with what we are now. After finishing my bachelor's, we all went into different hospitals. I went and worked in PD Indija Hospital in Mahim, Mumbai, and we also got enrolled into the ICU specialization courses. We worked there in the ICU. It was a wonderful experience. I wrote my CGFNS and I moved to United States. I wrote my NCLEX here, and I'd been an ICU nurse ever since. I married and moved to Brooklyn, where where my husband is from, and I started working as an emergency room nurse. Right from the beginning of me moving to United States, I had this vision that I want to do my masters. I want to be an independent provider. And I want to do something what I always wanted to do because I knew America was a land of opportunities. If you're ready to learn, there is no age which stops you from learning anything what you want. I could decide today I want to switch profession and become a lawyer. I could do that. That's the beauty
True.
and the opportunities provided by this land, and it always encourages learners. I decided to go back into my master's program for adult health nursing, which is now called adult gerontology, and I graduated as a nurse practitioner in 3 years in a hybrid program from one of the state colleges here. It's called Stony Brook University,
Okay.
and ever since I've been practicing as a nurse practitioner in primary care at South Brooklyn Health. I also have 9 years supervisory experience in one of the long-term care facilities while I was working as an ER nurse. So that was my 12 caps I held before I became a nurse practitioner.
So, what were the challenges that you faced? So, was there something that you can, recall of which did seem very challenging, but you could tide over it?
So when I decided to start the program, I was already pregnant with my second child. My daughter, I was pregnant. I enrolled into the hybrid online in-person learning program, which let me keep my employment and also do justice to my learning and be in. It was a lot of juggling to do. Juggling, it was a mutual decision made by us. It was a family affair. My husband, my mom, we had to they had to take up certain responsibilities. My daughter was the most beautiful baby you could have because she was wonderful in making sure moms could make assignments done well. She didn't trouble me. It was the challenge of working full time, the challenge of going for classes, the challenge of moving from the academic traditional way of learning which we do in India to a different
Yeah.
style of learning in United States, which is the APA form of writing with referencing. And believe me, it was a
Mm-hmm.
big change because I didn't go to school here. I
Right.
wasn't very familiar with that particular way of learning, and we all are so mindset on if you don't replicate the book you don't get marks or you don't get graded enough.
Right.
And here it was more about
Yeah.
if you did that, it was plagiarism. Mind you, we didn't even have AI
Mm.
to help you with the writing,
Oh, yes.
which is much more easy, I think, for students now compared to what it was before. It was also
True.
the
True.
financial struggles to pay the tuition. You have a family to sustain, you have a house, you have things, you have all these luxuries which you need to sustain, and plus you have to pay your tuitions which you have decided to enroll in. Luckily,
Mhm.
by God's grace, with all the support I could get, I couldn't thank everybody enough for that. And having wonderful mentors and bosses and preceptors who kept me going throughout the course, helped me with my ups and downs, helping me accommodate clinical rotations. That's like extra time of working without getting paid. And you had to make
Right.
the accommodation to ensure that your work is sustained. These are apart from that, you had to make a separate schedule which would work with that. The schedule had to match with the preceptor who you are rotating with. So it had to work with their work
Right.
schedule. Take time off from your
Right.
original working period if you needed to, work on weekends to
Hmm.
use the weekdays for rotation, compromising some of the family time and events which you could have been a part of to ensure that you completed this successfully. I think that was one of the most biggest challenges. And when I graduated, I did feel great. And I think my mom and my husband really feel definitely great because without them, they could have the hat and the gown, like I told them on graduation, because without them, I wouldn't do it.
Absolutely. I think when we decide, when a woman decides to pursue her life goals, professional
Mhm.
goals, I think it's not just the just the individual. I think the whole family, when they come together, and they need to come together, and that's when the lady progresses. I think well put, Shilpa. And kudos to you for bracing all these challenges and coming up out with flying colors. So if today, if I have to sort of tell a novice nurse, like if she or he wants to pursue gerontology nurse practitioner, what is the pathway like? I mean, what they, after they graduate in nursing, what else would they have to do if they have to follow your footsteps?
So basically, once you do your nursing school, you finish your 4 years of graduate nursing. Right? So in United States, on completion of that, they're supposed to take from the National Council, of state boards. They have to pass the RN exam, which gives them the license to practice. Everyone who does that, depending upon their insight on what they want to do in their master's program, whether it's Masters of Science in Informatics, nurse practitioner, whether it's your direct Doctor of Nurse Practice program, every school has a requirement of having a 1 to 2 years of clinical experience in the field before you join into the program. This program typically is around 2 to 3 years. If it's a full-time program, it's a complete 3-year program for DNP students who do the Doctor of Nurse Practice, which now is a direct program. If initially you had to do your master's separately and then go in for your DNP. Now we have direct programs, which in 3 years you can finish the Doctor of Nursing Practice program. Once completing your master's in science and your nurse practitioner, informatics, education, any of the specialties which you have chosen, you have to do the certification by the body of the ANCC or the ANP, which is the ANCC is like the American Nursing
Credentialing.
Credentialing Services, and then the
Yeah.
ANP is the American Association of Nurse Practitioners. Once you have done that,
Right.
you're ready to practice, and all institutions require your certification before you come in for practicing.
Right.
Yeah, so that's basically the pathway to go, and like now nursing opened up a whole new umbrella, so you can go wherever you want. And I always tell my students who I precept is something you're going to do for the rest of your life. And you need to enjoy this if you want to do this. So pick what you enjoy.
Thank you for sharing that thought. And I think it's going to be probably a similar pathway in nursing. Yeah. Like I said, the first batch has come out now, and maybe after few years, I'll interview them and try and understand how does it match up with what happens in US as well. What is like a day for you? If I have to ask Shilpa, what is your day like from morning to evening in your profession that you're practicing?
So I start off my day. When my day begins, it's a 7 o'clock day for me. I take an earlier shift. When I start with my day, I have another 10-15 minutes before I start seeing my first patient. I take time to review my schedule and to see who all are coming today for a visit. I have patients scheduled every 20 minutes who come for either they come for their routine primary care follow-ups every 4 months, 6 months, 1 year. I have patients who are new patients who are new to the practice. I have people for their employment screening. I have patients who belong to me. They must have been in the emergency room for an acute event and they come for a follow up post their acute event. I could have patients who were hospitalized. They belong in my panel and they come in and they post hospital discharge within the 2 weeks. I bring them in to make sure the meds are reconciled, everything is going well, what are the changes made, what was the new acute event which was done, and I have a lunch included in that. Once a week I have 4 hours of administration time where I go in filling home care forms, employment physical forms, doing prior authorizations for medications which were not covered by insurance and maybe they need an alternative, or I try to get the authorization. Procedure authorizations, because everything works through insurance here. So there is the pathway to follow to ensure patients certain procedures like the MRI or as a CAT scan which was denied is approved, or what are the alternatives of diagnostic treatment do I want to do. You see all these patients, you order diagnostic tests, so you need time to review them too. Review them,
Right.
it's in the next intervention you want them to do. See if you want to bring somebody sooner in, all these clinical judgments and decision making is done. Every day you look through them, and at the administration time admit given to you, you go through them. So this way you can balance the practice and also take care of all the diagnostic and treatment interventions you have ordered. I
Yeah.
also work Monday to
Yeah.
Friday. So I do a 5-day shift. There are people who do 3-day shifts, 12-hour shifts, 10-hour shifts.
Mhm.
We have the
Right.
flexibility of work here, and that's a blessing.
I agree with you. It's the same here in UK. You can either do a 12-hour shift for 3 days, and if you want, you can go and work extra, or you want to pursue something else, you can do that. I think that's what the beauty is. I think people acknowledge and appreciate the contribution that you make, and they also draw boundaries between your work and your personal life and the professional life. And I think that leaves us a lot of time to pursue what we want to do otherwise as well. So I think, and that's what I keep on telling. I think why nurses move to international countries from India is not just because of money. I think there is a better quality of life that they probably seek. They want to be appreciated for what they do, acknowledge, receive that acknowledgement, and I think that is primarily something which is taking time in India to develop. Hopefully now with so many nurse leaders rolling up their sleeves and I wouldn't say fighting the battle, but being advocate for the nursing profession, it is changing in some of the hospitals, but I hopefully in few years it should change more in India. Shilpa, what I wanted to know was, so when you spoke about all that you do in a day, does it also involve any clinical procedures that you have to do, or and does it involve a prescribing authority as a nurse practitioner for you?
So my job also includes treating and recognizing, diagnosing, treating conditions, right? We all are authorized to prescribe. We're
Right.
independent providers prescribe with the prescription authority we have. Provide, we do the screenings, we order tests for the screening, we do vaccinations for preventive medicine, we treat the chronic illnesses of diabetes, hypertension. Being a gerontology nurse practitioner, I also deal with complex conditions like dementia, Alzheimer's, including physical and mental health conditions, collaborating with like subspecialties. The difference
Right.
between the nursing in India and nursing in America when it comes to these things are we are respected and recognized for what we do. There's a mutual
Right.
respect between collaborating providers. It can be a MD physician, it can be specialty neurologists, psychiatrists. We work as a team to treat the patient. We don't have that differentiation, right? Or she's a nurse practitioner, I'm an MD. Of course, it is there, but to most of the part, they realize that having the nurse within us and being a provider thereafter, we are more empathetic and more, I guess, efficient in providing a comprehensive care. So that's what makes us stand apart and be able to prescribe, not depending on a supervisory physician, unlike the physician assistants we have, which gives us the momentum in comparison to other healthcare providers in that aspect. And we also meet the challenges of the primary care shortage we have in the country. And the demand for prior is high. To improve this access,
Mm.
and nurse practitioners are, I should say, a better option to provide comprehensive care, improve the access at a reduced cost compared to a physician colleague.
Yes, so in a day, like how many patients do you have to see? Is it restricted that you will be seeing only so many patients? Because you said that you have a 20-minute slot for every patient, so there might be like a maximum patients that you can see per day.
So the 5-day week schedule, I end up seeing around 18 to 20 patients a day. And it might
Okay.
sometimes be higher if I choose to see somebody urgently and I take it upon myself to bring them in sooner. It can be lesser if somebody doesn't show up
Right.
for the visit. So there's always a fluctuation, but there's no max cap
Right.
because the max cap comes with the time framework you have invested in the working hours. Right? And it can be a few
Right.
patients up and down based on, every day is different. Patient care is different.
Right.
Yeah.
Right. And so, when you talk about this clinic, so do you have to sort of physically go, or is it like a hybrid model? Can you do some consults from home as well? How is it?
So during COVID, we the telehealth was the biggest change which happened. We were able to do in order to
Mm.
make sure the care wasn't interrupted during COVID. We still had to be in person there, but we had the option of doing telehealth
Right.
services. We
Right.
went and paired up with different companies to improve the telehealth access through the EHRs and companies like Doximity, where we could send texts and do the telehealth. Once COVID was over, at that time we had the luxury of being home and doing it. Certain days you wanted to be home. But now we have a hybrid of in-person and telehealth. But for all these options,
Okay.
currently we are preferred at the institution to be in there. In case you have an
Right.
emergency or there are situations where you have to be at home doing the telehealth services, they definitely allow you to do that. My facility has
Okay.
restrictions on that now because of the fact that there has to be a balance maintained to make sure we are at the highest billing end of the visit. Other facilities which work in New York
Right.
City itself, they give you the luxury of doing from home. There are in-person visits are given.
Hmm.
You can charge them as the same. The telehealth, which is with video, has the change bill has the so other facilities do let
Okay.
the nurse practitioners do that. Behavioral health nurse practitioners are completely telehealth if they choose to. They could be in
Mhm.
person if they choose to. So there's a lot of flexibility with, I guess, the blessing of COVID.
That's true. I think it literally changed the way we provide healthcare, I think, across everywhere, across the
Mhm.
world. And it has definitely changed. I think it has, to some extent, it has made it very innovative and easier also to deliver healthcare, I think. Yeah. So the next thing I wanted to ask is, how is the role of the gerontology nurse practitioners integrated in the healthcare system in the US? And do you think we can learn something, lessons that we can learn for India from the model that you will practice there?
Like I previously mentioned, right? The United States has a shortage of physician providers for providing primary care. We need,
Yeah.
there's a huge demand for increasing access to care for everyone, especially in our rural urban communities, right? Where we have
Yeah.
underdeserved communities. We want to make sure, because we believe in preventive before the treatment part of the care comes, we want to make sure everybody
Yeah.
gets the care. There's a rising age group. We have the baby boomers which are
Hmm.
there. We have a older generation which is growing old, and because the
Yeah.
access of care is important to ensure all the health screenings, vaccination, the preventive care measures are done to keep them healthy to whatever age of life they are living till. In United States, gerontology nurse practitioners, they have been integrated in different healthcare systems. Some of them, they could be primary care providers in an outpatient clinic. They could be independent providers in a private practice. They could be providers in a long-term care facility, like the nursing homes, the skilled, the long-term nursing care facilities, the short-term rehabs. They could also be working in urgent cares to deal with acute situations. Their knowledge, compassion, the use of evidence-based practice, which they use for and following the guidelines which has been laid down, has led to our population accepting them more compared to our other colleagues. They have that this is
Hmm.
why the demand of the profession has increased, and
Yeah.
they help with everything. They help with providing the treatment, diagnosing, treating for chronic health diseases, mental health problems, reducing hospital readmissions because we get cited for them. You know, they have access when they need the provider for an acute problem. Like, I'm seeing my primary care provider every 4 months. Today I woke up, I'm not feeling good. I want to walk in and see my provider. What do I have? If the average wait time here to see a specialty clinic or a specialty provider is anywhere from 3 to 4 months. So improving the access to the healthcare is a big. Being in United States, we have, and being in New York itself, we have a lot of health disparities. People with low socioeconomic, we have immigrants who are uninsured, providing access of care to them and providing what they need to be in their best ability and best health is very important. So that's where nurse practitioners, gerontology nurse practitioners have a huge impact on what they do in healthcare system and basically. Also, India has a big aging population, right? Before, back in the days, we say if we live 50 years, that's big enough. But no longer. Now we have people growing older. They're being more health conscious, right? Back in the days, it's like once
Yeah.
you're a mother, you're not worried about your health problems. Obesity, simple as that. Oh, this is from being a mother.
Hmm.
Nothing. You take care of the family, you forget to take care of your own self. Now, the thinking approach has changed. Everybody knows no matter how much you make in your life or what you do in your life, you need to have the health to sustain your viability. So we pay more, and now we are paying more attention to prevention. We are making sure before a problem occurs, we are doing interventions before we go into the high risk groups. You know what predisposition you have genetic wise from the family. So being more careful, being more mindful about your lifestyle, doing exercises, making sure you meet all your screening procedures of mammogram when you're 40, doing your colonoscopy to prevent colon cancer screening. If you've been a smoker, doing your lung cancer screening or trying ways to quit smoking. So there are a lot of things which India can learn, we can do, and this will help our own aging population, our own family, relatives, friends, being more proactive towards their health conditions. Nurse practitioners can be an asset for that. They can help our colleague physicians work hand in hand, collaborating with them to ensure our own population gets the care they need and in the best way they can get it. I think our policymakers in India should provide that. They should fund programs for nurse practitioners, provide learning incentives. Tuition is a big thing. So we have here at Health and Hospitals, we have loan forgiveness programs. We have programs where they help you reduce the cost to a certain institution. They tie up with institutions, so more and more nurses can take up a career in the field they like and then give back to the same hospital or the healthcare system and be an asset for them. So I think that's something we should learn from here.
Yeah. I agree with you on that completely, because the other day when I was also speaking to another nurse care practitioner, and that's exactly what they have realized, that it really reduces the burden on just the physicians who have to provide care to so many people
Mhm.
in reducing working waiting times. I mean, although yes, we do have a mixture of public and private health in India. People prefer more of private health, but I think there is a huge population who needs, needs to access healthcare, and because of the waiting and because of the finances that are required, I think people stay away from that. And I think somewhere you're absolutely right. When nurses get into primary healthcare, I think this is where they can make a huge impact, reducing the burden on the doctor fraternity, assessing the patients and recommending them for secondary or tertiary healthcare. I think that is certainly going to change in India. Like I said, we'll see when the first batch comes out and how much difference it makes. I think it's like a give and take, isn't it? The policymakers are there, but the moment we start showing that impact, I think they will be more motivated to embed that in the Indian healthcare policy, and hopefully we'll be seeing that change in a couple of years. That was our next question, actually. How can policymakers in India encourage the development of geriatric nurse practitioners? I think there was a little uproar in India in between, where I think in Kerala, where they were trying to give more responsibilities to a geriatric nurse practitioner over there, and that's when the medical fraternity was like, no, no, we cannot give what we do to the nurses. So, what do you think? How can the policymakers, like you said, embed this into the whole healthcare system so that the nurse practitioners become more valuable to the Indian community?
So I guess this was a similar challenge we had here when the first nurse practitioner program started in the United States, right? The medical council was the first barrier they
Mm-hmm.
had to cross over, because the very fact of the feeling of them letting go of the power and authority and giving it into sharing the privilege with the nurse was the most difficult breakdown which the whole nurse practitioner association had to do. I think first of all recognizing and looking at the various programs in different countries, right, which have integrated the nurse practitioner concept in their education system, recognizing the value of their programs, establishing an educational framework, a good curriculum, which will help make the nurses, right, switch in from their role from being a nurse to a provider shoes, and learning to be given enough practice training, incorporating training in the curriculum which will help them work independently, providing them with resources, providing them with web pages or access to literatures where they can access to see if they come. Every day is new when you practice, right? You might be practicing
Yeah.
for so many years. You might come across things that will be new to you even after so many years of practice. Having that type of support system available while they're learning, putting them through a good, rigorous training program. The fact of getting them out of that nursing shoe and being more in charge of what decisions they make in life related to practice, right? During their training program is very important. I think if we can make, if we in healthcare in India, right, when they're making this education system do that, that will be like the foundation for them. The second thing comes is giving them like a residency training for a year where they graduate from, if they have a hospital affiliation or they have a hospital of their own, if they have a 9 month or a year program where they work in collaboration with their physician colleagues. Because here, as a new nurse practitioner, you need 3600 hours of collaboration with a physician provider. The first physician provider, whoever you are working with, you need to have somebody who is supportive, who's respectful, and who takes you through that learning journey and builds upon your foundation. So if the foundation is strong and the first floor of the house is strong, I think we get a long way. And having collaborative people, like you can have a good education system there within a hospital or within a education system or a college of nursing where you're graduating from, having good educators, having experienced educators, having people who make you think critically, having people who will make you brainstorm on situations, giving you good clinical rotations where you are put in situations where you have to act, not just shadowing, where you are put in shoes where you have to act. You have to come up with your assessment, with your SOAP notes, with your diagnostic differentials as to what you think would have been the conditions. What is your approach to, downgrade them to the final answer of the condition? What tests you order? Having all this inbuilt into the curriculum plays a very important role.
Mm.
Also, making sure everybody who's involved in this journey, including the medical council, to initiate conversations to obtain buy-ins. So there is a widespread acceptance of the nurse practitioner programs, which technically, for some reason, it is deemed as a threat to the medical providers or the medical doctors. Like it's a threat for their profession. I mean, if we give
Yeah.
them this, then maybe our demand is going to be less. Not thinking it in a
Yes.
way that we are going to collaboratively take up this challenge to make sure our country gets better in healthcare services, which we are getting. Our country, our own people, our own community, right? They get the same amount of healthcare services. I think that's the buy-in which we need to work on. And I guess, like you said, the first batch which graduates out, their performance becomes the face for all other NPs who come. I was the first nurse practitioner who started doing primary care in the hospital I'm working. Do you think I was accepted with open arms? Not at all. I had to make my way. I
Ah.
had to put my foot strong. I was lucky to have a supportive boss, but everybody doesn't have that luxury, right? You also need to learn to stand up for yourself because not every time somebody will be standing up for you. If you never ask, the
Mm.
answer is always no. If you do not decide to make a change, there'll be no change taking place. You can sit and complain in your house. I
Yeah.
founded the first shared governance nurse practitioner council in our hospital, and we have these things. We bring up practice issues there. We meet up with administration, clinical administration. We make changes to our practice, but it's through a shared governance approach where we mutually come in. And to get somebody to buy in, I totally understand it's a difficult task, but if you don't try, it doesn't happen. If you don't provide evidence based practice literatures, if you don't show them a positive impact, you don't move anywhere. It's a long journey, but it's not easy, but it's not difficult either. One day at a time.
Absolutely, that's brilliantly put, Shilpa. I mean, I'm quite impressed, and everything that you said is it's so much of value. The curriculum, right from the way the curriculum is designed to ensure that we empower the nurse practitioner to do what is right. That's one, and also to instill the confidence in the medical fraternity that this nurse can work up to the highest potential of her license. I think that's a very brilliant point that you made, and collaborative practice is something that people have to be acceptance of this fact now, because in our college, when we were in our school of nursing, when we were graduating, we always learned about healthcare is there's a healthcare team. It's not, patient is the center of it and we all are around it. The diagram they used to show us in college, right? But it was used to remain only in the papers. Yeah, but now I see there's a lot of collaborative practice all across the globe. In India as well, a lot of collaborative practice has started. But I think when it comes to nurse practitioners, I think that is something that people have to, the medical fraternity especially has to let go, saying that we need more hands, feet on ground, more hands, more hands with rolled up sleeves helping them. And I think they should look at nurse practitioners, not taking away what is theirs, but in fact helping them to work better, to provide better healthcare to the patient. So I must say that you've really covered all the necessary requirements so that nurse practitioners perform to their optimal level. That's a lovely discussion we've been having, and thank you so much for that. And this brings us to the end of our first section, moving on to our next section called the rapid fire. We've discussed this, and it's like I will ask you a few questions, and whatever first thing that comes to your mind, you can just shoot it out. So, are you ready then? All right. So, let's begin. So, the first question, one piece of advice for our aspiring nurse practitioners globally.
I think it is never stop learning and being compassionate in what you want to do in life. Your patients will always remember you for that one special thing you have always done, no matter how many years go by.
Absolutely, that's wonderful. And one common misconception about geriatric care that patients people have across.
I think that would be that people have the concept that older people are really old, frail, complex, and they have multiple problems, which is very difficult to manage, which is not true. I think being a primary care provider, it's the same. So sometimes you grow old with this whole population group, practicing so many years, and you know them in and out. So it isn't true about them being old and complex and difficult to handle.
That's true. I have in my research, I have one of my patients who is a 80-year-old lady. She doesn't look like one. She drives her own car, comes to my clinic every month, diligently remembers everything that she needs to bring along with her in her clinical trials. So I completely agree with that. That's the biggest misconception. And I think I'm not ashamed to admit that I had this misconception, but that's completely changed from the time I started practicing in UK here. Right, moving on to the next one. One proudest moment as a gerontology nurse practitioner.
I think I would reflect to a moment where I managed to give autonomy to one of my older clients, I should say, belonging in the geriatric program and making them capable of feeling more independent with the community resources we could provide and making her independent of living the rest of her life, not being dependent on somebody or sitting at home and saying, I'm too old for this and I don't have a life. I want to die right now.
That's amazing. And I think that's what they look at, a voice that tells them that you can do this. And that's awesome, Shilpa. In one word, where do you see the nursing profession headed in the next decade?
I see a lot of innovation and I see a lot of graduation from the traditional nursing role to a big, big platform of various fields where I see nurse leaders practicing in informatics, in education, empowering the healthcare system, working in collaboration, and India being more open to them in achieving their highest scope of practice.
Oh, that is something that yes. The other day I was being interviewed by my hospital, and that's what I told them that when we ask somebody to envision a nurse in their head, an image of a nurse, it's always like a nurse is probably doing some clinical procedure, or giving medicines or something like that. But that is what we would like to change. When next time somebody imagines a nurse, we want them to imagine a person who's more capable to take more decisions, standing at the helm of affairs, leading the teams, making decisions, like you said, in digital care. And I do see that happening. So hopefully what you and I envision is going to, be true and can materialize in the near future. So if you could change one thing in the Indian nursing education, what would that be?
I think integrating more of geriatric focus courses, right? Because this is my field of interest. More of geriatric care courses and training in the nursing education programs. Just like they get trained in OB, they get trained in pediatrics. Geriatrics itself is a huge, huge playground by itself, where you need to know every corner of the playground. The physical and the mental health conditions are more complex to deal with if you have no understanding of it.
And one thing If you could change in the Indian nursing practice, what would that be?
In Indian nursing practice, definitely teaching them, allowing the nurses to specialize in their fields of practice and letting them work independently in their fields of practice. If the nurse practitioner programs come in, giving her a few extra clinical courses which will help her independently do procedures in that field. If it is something in geriatrics clinic or a long-term facility where a nurse is, if nurses are working, giving them extra courses over there, helping them grow in their specialized roles. I think that's the simplest way to say. That's one thing that Indian Nursing Council should work on.
And the final rapid fire question, Shilpa, it's a different question that I'm going to ask you. How would you, in one word, describe your journey of the past 20 plus years in nursing?
That's a good one. I have to, I first of all would like to thank you because of this interview, it took me some time to look back at what has happened over the past years, right? And I think one word, if I have to explain that, I think I'm really blessed. And I think that's the best word I could use to put everything together. Blessed, blessed personally, professionally, academically. I think blessed in being in a society. And I think blessed in being a land which gave me all the opportunities. And I'm hoping India can do the same.
Yes, I'm very sure, Shilpa, because indeed I spent my first 20 years of my career in India, and the way you feel blessed where you are today. I felt blessed too because it helped me grow in the career there, not just as a nurse, but as a healthcare quality. It gave me an opportunity to be an assessor for the entire country. So I think what you rightly put, if you believe in yourself and if you can envision a different pathway for yourself, and if you're ready to do that hard work and commit yourself, I think anybody can have a very massive trajectory in nursing. Like we all, I remember the good old 4 years we spent together. Uh, it just went by, first years. We had a lot of fun, right? As friends, as colleagues, dancing together, the dance partners, the annual day functions. When I think all about it, I think those were the wonderful days of my life. And you were at that time also known to be a very assertive person, standing for yourself. And I'm not surprised where you have reached today. And the way you said that you were the first nurse practitioner in gerontology over there, and you had to fight your way up. I am not surprised that you've reached where you are today, because you're always a person who has stood your ground, believed in yourself, and knew that people can make a difference. I remember when you had won the, was it not just Miss LT? I think you'd also won at the university level when it was a beauty contest, intellectual contest which we had, and I think you had won that. And and we always had that competition is within the 4 years, and we're like, yay, our person became the the carrier of that award. So we were so delighted, and I'm not surprised, and I truly mean when I say that I am really, really so proud of you to see you, to share space with you today, and to listen to what journey you've gone through. And I'm sure there'll be many nurses who will be watching this show, who will be inspired to take up a similar career pathway to grow. And I'm sure, like you said, there are nursing is growing very broadly. There are so many roles that are being offered to nurses. And I'm sure somebody who's watching this would take a leaf out of your book of your journey and get inspired to do what you have done. So thank you so much for being on this social. And thank you for the times that we have spent together. And we've learned together so much. And today, where we stand as not just as professionals, but as mothers, as wives, as daughters, as daughter in laws, and could do so many things. And I think you beautifully summed it up saying we feel blessed. Yes, we are indeed blessed. I think the first blessing came when we came into the field of nursing, not knowing where we are heading. But I think it's been a lovely journey, and I'm sure you share the same feeling as well.
Thank you, Pearl. Thank you for those kind words. But like I said, it was what our school taught us, right? You could have all these traits in you. If you didn't have the foundation grounds, I don't think we would reach anywhere. And teaching us to survive in whatever conditions we are thrown in. I still remember our days when we went to Malavni and Palgar and everything, and in this hot sun, and I'm like, oh, God only knows why we have to do this and why we have to go into these houses or go even the polio drive of giving polio vaccinations and doing the population drive of counting the census in the houses. Even At that time, it felt meaningless, right? But we enjoyed the company, going together, having the same group of friends and, sharing our ups and downs and living in places where I guess till that moment, we never got a chance to live in a rural community, living in their same healthcare standards, understanding their healthcare disparities, the social determinants of health, which was there. That itself is a big learning curve. And, I'm blessed, like I said, to have friends like you, I feel honored when I see my friends, my batchmates becoming something. I precept students when they graduate. Most of them, some join my hospital. I feel great when I see them doing well. It's like being a mother, right? You get pleasure out of seeing your things grow. And I'm
Right.
blessed, and I really thank you for giving me this opportunity, right, to come up and share my experience. I'm again happy to reconnect with you on a professional ground. I'm happy with your success and the influence you have on all our nurses, and being a part of a journey to impact India, to have more nurse practitioners, more nurse educators, more nurse leaders, having nurses grow up and do what they want to do and enjoy what they want to do. Because if you don't enjoy, you don't have the same amount of impact on what you're doing. I think you're doing great. Thank you so much for that.
It's been my pleasure. It's been my pleasure, Shilpa. Thank you so much for taking out time on a weekend and being with me and enjoying this. I enjoyed a lot. So thank you so much.